We're gonna start with vagal nerve exercises. And the point here, and if you were to take a session with me, I would go through some of the philosophy behind it, but what can happen is these occipital bones can get very tight and tense, and it can shift our cervical spine, which can cut off the blood flow to the rest of our body. So I like to start with the vagal nerve exercises, and then I move down to the intestines to get that circulation, and then we work on stretching and tapping and some other stuff that will help release that. If you do get really dizzy, because it is a side effect of trying to do these right away, then just stop. You can shift your eyes forward. You can just take some breaks. And I'm going to cue the breathing because it is a side effect of doing this at first, especially if you have a big imbalance, then dizziness and nausea can potentially happen. So just so you know. Okay, so I'm going to get you here. So I'm laying down on my back. You can see me okay? All right. You're laying down on your back, tailbone relaxed, feet flat on the ground. Place your hands on your belly, close your eyes down, and just breathe deeply into the belly, in through the nose, out through the mouth. Exhale. 2 more breaths just like that. Clasp your fingers together. Place your hands behind your head so that they're cradling your skull. Let your elbows relax down. Face your eyes forward, so you're looking straight ahead of the ceiling. Now you're going to move your eyes to the right as far as you can, keeping your face forward, keeping your nose pointing towards the ceiling. You're just moving your eyes to the right. Don't forget to breathe deeply into the belly, holding your eyes all the way to the right, like you're trying to look at your elbow. You want to hold these positions for about 30 to 60 seconds at the most. One more breath. And now bring your eyes back to the center, take a breath, and look to the left. So you're looking over to the left, trying to keep those eyeballs on like the horizon level, not horizon, but just, you're not looking up or down, you're just looking to the left as much as you can. Breathing into the belly. And look your eyes, face your eyes forward. Bring your hands back to your belly. Just close your eyes down. Take a deep breath in. And now you're gonna roll over to the side. So you're like in your fetal position. And you can press yourself up and just be careful coming up to a seated position because that's when the blood flow can start to impact, or like you can get a little lightheaded. Yeah. Okay, good. I'm gonna go to a chair, but you can stay, actually no, I'm gonna stay down here, sorry. I just wish you were a little bit higher. Let's see. There we go. All right, so I'm sitting down with my legs crossed, or you can just sit in any comfortable position. You can wiggle your spine. And now you're gonna move your eyes over to the right, like we did before. And then you're gonna tip your ear down to your right shoulder, keeping your eyes down looking towards the right. Breathing deeply into the belly. Making sure that nose is pointed forward, that chin is pointed forward, and it's more about the ear coming down to the shoulder. Eyes looking down. Bring your eyes back to the center, float your head back to the center, take a breath in, and looking over to the left. Eyes shift, ear drops down, nose pointing forward, eyes are trying to look down towards the shoulder. Face your eyes forward, bring your neck, head back. We're going to do that one more time, but we're going to do the eyes in the opposite direction. So you're going to look to the left and tip your head to the right. And you can shift your eyes. So again, they're on that level playing field in a way. So you're not looking up or down. You're keeping them on that straight pathway, looking to the left, keeping your head down, to the right, chin and nose forward. Holding for 30. If you notice your body wanting to, or your mouth wanting to swallow, if you notice you wanting to yawn or sigh, let that happen. That's a sign that you're activating your vagus nerve. Bring your eyes forward, coming center. Looking over to the right, ear down to the left. Nose forward. You can move that chin. And now you're going to face your eyes forward, bring your head back. Take a breath in. And now just move your neck around. Just notice if you feel anything different. There is a neurological connection between the eye muscles and those occipital bones. And so by moving the eyes in these different directions, we can release some of that tension and kind of open up that back of the neck there. Those are 2 vagal nerve exercises. And now we're going to move into some intestinal work. So we just tried to shift the cervical spine open to allow that blood flow into the brain. Now we want to try to get that circulation moving. So I'm going to move to a chair. You can stay seated on the ground. You can do whatever is comfortable. I like to have a harder surface and my legs fall asleep. So. All right. I'm gonna move this. The Zoom life. Getting it out of the way. There we go. All right. So what we're gonna do first is go back to that breathing. Bring your hands down to the low belly. Take a big inhale in through the nose, breathing into the belly. Exhale out through the mouth. 2 more breaths. Inhale and exhale. 1 more. You can lean back if you do have a back behind you of a chair. If not, you can just keep your back straight. You're going to bring your hands to fists, and you're going to start to lightly tap the lower abdominal area. So you want to try to tap the 2 inches below your belly button to try to get a little bit of that stimulation, some of that vibration in the gut. If you notice any hypersensitivity, just breathe. If you notice any pain, just breathe. Tapping 2 inches below the belly, breathing into the belly. By the way, this music is by HemiSync, and it's meant to drop our brain waves down into the alpha state, I believe. So if you feel like your mind is wandering, you can come back to the music, come back to your body. This is about building that awareness and sensitizing your brain. Breathing in. On the count of 3, you're gonna stop tapping and you're gonna bring your hands to your thighs. 1, 2, 3, hands come down. Feel your body, feel the vibrations that you just created inside. Inhale. Exhale. Bring your hands back to the abdomen. You're going to circle your hands in a counterclockwise way, up the right, down the left. That's the way of your digestion, bringing a little bit of warmth and heat to this area. Pause at that lower abdominal area, so below the belly button. We're going to do something called intestinal exercise. You're going to push the belly out and pull the belly in. And actually, you want to be taller. So if you are leaning back in a chair, then just make sure that your spine is tall now. You want to push your belly out and kind of dump it forward, and then pull it in using your muscles all the way to the spine. Push it out, relax, engage, pull it into the spine. Pushing out, pulling in. So we're going to do this kind of rhythmically. Out and in, out and in, out and in. Keep going. You can close your eyes down, relaxing the belly in. You can turn your head side to side if you notice any stress creeping up into the shoulders. We're trying to bring warmth and circulation to the intestines, where there's 35% of our blood is within this area, and it can become cold, it can become stagnant, it can become blocked. So by doing some of these exercises, especially after we've opened up some of the pathway to the brain, we can really start to improve circulation and flexibility internally. Keep going in and out. In, out, in, out. As you do this, notice your breathing pattern. Do you want to inhale on the way out, or do you want to exhale on the way out? What does your body naturally want to do? The way that it should be is you should want to be inhaling on the way out and exhaling on the way in. And if you aren't doing that, or if you find that your breathing is off, it could mean that there is an inverted breathing pattern, which is a sign of sympathetic activation or fight or flight. So we want to really tap into what the body wants to do and just keep the breathing easy, but guide it towards inhaling on the way out, exhaling on the way in. Let's go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Move those hands in that counterclockwise, up the right, down the left, bringing the hands on the palms, just breathing into the belly. And now we're going to move into some spinal mobility and opening up some of the tight areas within the body, really moving the joints. So a session like this would go with these sections where we start with the vagal nerve and then we move into these different areas, but they would be longer, obviously. So I'm just giving you a little taste. Let's actually start with the spine straight. Drop the chin down to the chest. Inhale into the back of the neck. Exhale. One more inhale into the back of the neck. Exhale, float the neck up. See if you can go back easy though, just back. How much access do you have back there? And then coming center. And then drop the ear down to the right. Breathing in. And then you can drop that chin down, keeping the head tilted, looking down towards your right hand. And then move that chin back up all the way as much as you can. And face the chin forward and coming center and over to the other side. And bring the chin down. Breathing, keep breathing into the belly. The more diaphragmatic, move the chin up. The more diaphragmatic breaths we can access, the more we're going to activate that parasympathetic nervous system, which is the goal. And bring the head center and just easy rotate. Find some freedom in the neck. Bring your shoulders back, roll them back twice. Roll them forward twice. Bring your hands to your shoulders, elbows together. Bring them up. Inhale. And then exhale, open the chest and the chin. Oh yeah, I got a big sternum crack there. Do that 2 more times. Elbows in and up. And open. And around. And they touch and then they come up to the sky. Inhale, and then on the exhale, open as wide as you can. And coming back. Bring your hands down, just feel your body breathe in. Exhale. Rotate those wrists. Rotate them the other way. Move the elbows around, just move them in rotation, whichever way you can. Good. We're going to go up and over to the right side bend. You can have your hand on the ground. You can have your hand on the chair. Looking up towards the ceiling, breathing in. And exhale back to the center. Other hand comes up and over, bringing a little bit mobility. If you feel any cracks, that's your body's way of releasing the stagnant energy. And exhale back to the center. Bring your hands back to the thighs. Take a deep breath in, really trying to access the energy or the breath as low as you can. So we want to move the breath as deep as we can into the lower abdomen and expanding that belly, relaxing that belly down. So just breathe into the belly, inhale, exhale. Good, shake that out. Just wiggle back and forth. Feeling the tailbone on the floor and the chair, just wiggling back and forth, finding some mobility in that spine. We're going to move into the tapping and the connecting to the energy, the sensations of our body segment, okay? So first, we're going to start with our hands together like this. You're going to find your breastbone right there. Make sure you have clothes between your hand, and you're going to start to tap that breastbone here. And you're just going to close your eyes down and keep tapping that hard spot in your lower chest area. Exhaling through your mouth. Inhaling through your nose. It's almost like you're knocking at the door. Seeing what you can release. Breathing in. exhale. You can move your hands to a fist position and start to tap on the opposite side of the chest. Tap on with the other hand, and we're just tapping all around the chest area. Breathing out through your mouth, going as hard or as soft as you want. Obviously, don't hurt yourself. Thinking about breaking up the anxiety. When I have anxiety, it builds up in my chest, and by doing some of this, it can really break it up and reduce that feeling. Bring your fingertips right below the collarbone and tap. Breathing into the belly, deep breaths, expanding that belly, and do what you want. Tap away on the chest. Breathe out. We're going to go for 5, 4, 3, 2, 1. Release your hands. Make your palms face each other. Feel that vibration you just created in your hands. Focus on the negative space between your hands, that tingling feeling of your fingers. That's energy. That's sensitizing your brain to your body. This is how we can change our habits, by connecting deeper to our body, and this is how we can learn to listen to our body. You might hear that a lot. This is how we do it. Bring your hands back together, back to that spot where we're the back of our hands. I want you to find that solar plexus, which is that really sensitive spot about halfway between the belly button and the breastbone. And I want you to just start to lightly tap that. It's that feeling of, oh, I got punched in the gut, you know, that really sensitive spot. Just lightly tap it. I just want you to start waking up that area, breathing in, breathing out. Waking up these organs. We've got all these visceral organs. We've got so much going on in the abdominal cavity, and we can get really stagnant. We can get cold. So some of this physical movement will actually help that. Start to bring your fingertips down to your belly button. Put the middle fingers into your belly button. You don't have to touch your skin, but just go over them. And try to relax your belly as much as you can. And I know this is really uncomfortable sometimes, especially for women. But the more we can connect to this area, the better. I like to think of it like pushing down on a waterbed. Back in the day with the waterbeds. And bring a little slight smile to your face, smiling to yourself. It's almost like you're giving your belly CPR. This is an actual method developed by Ilchi Lee, Body and Brain Dawn Yoga. Good. Bring your hands back to that position where your palms are facing. And just start to shake your hands. We're going to end with a little bit more vibration. We're shaking those hands. I want you to feel how that vibration impacts your whole body. So if you're sitting in a chair, if you're on the ground, you'll be able to feel your tailbone kind of gyrating against the floor. You'll be able to feel the vibration in the arms and the neck and the head. Inside, maybe even all the way down to the feet. I do. Keep shaking those hands and vibrating them, breathing in and out. For 10 more seconds. 10, 9, 8, really shake, vibrate. 4, really getting any of that stagnant energy out. For 3, for 2, for 1, come to complete stillness. Keep those hands facing each other. Feel the body. be as present as you can. Focus on the sounds, focus on the sensations, focus on my voice. Keep yourself present. One more breath. Bring your hands together, rub them, clap them 10 times. Bring them over your eyes, cup them over your eyes, move your eyeballs all around. Look to the right, hold. Look to the left, hold. And just easy swipe down the body. Breathing out. All right, that is your 15 to 20 minute routine. The point of this really is that we don't take enough time to just allow our body to relax. And so if we can schedule it in, you may notice a huge difference in your gut health. And I really thank you guys for coming and for even watching a recording of this. Please reach out if you have any questions at all, and look out for that email as well. Thank you so much. And I hope to, you're welcome, Mary. Thank you so much for coming.